My name is Seth Pajak, and I'm with the Atlanta Veg Fest. As you know, we are doing a series of interviews with vegans in the Atlanta area. And today we have a special treat. We have Dr. Naik, who is going to talk to us about a variety of current events, as well as what it's like to be vegan. So, Dr. Naik, can you tell us a little bit about yourself and what kind of medicine you practice and how veganism plays a role in that?
Hi, everyone. So Seth, first of all, thanks for having me. As you know, I'm a massive fan of Atlanta Veg Fest. I've been vegan for quite a few years before I discovered Veg Fest, and so I'm kind of bummed that I missed the first few years, but I've been vegan for a little over 9 years now. My background is that I am board certified in pulmonary medicine, critical care medicine, and lifestyle medicine. I used to also be board certified in internal medicine, but I've since let that lapse because I don't need it at this point. My background is actually lung transplantation and ECMO and advanced lung disease. I don't really do that stuff anymore. I do mostly critical care and pulmonary medicine, so lungs and ICU. And then I also do lifestyle medicine, which is a newer field of medicine that focuses on counseling patients to reverse chronic diseases like type 2 diabetes, heart disease, but also things like inflammatory bowel disease, rheumatologic conditions, things like multiple sclerosis, through 5 basic tenets. So the first one is diet, which is prescribing a whole foods plant-based diet. The second is exercise. We know that regular exercise is critical to decreasing risk for things like cancer and heart disease. Stress reduction, coping skills for that kind of thing if we can't reduce stress. Making sure that we have a good social support system, and then avoiding risky behaviors like drinking to excess, smoking, unprotected sex, those sorts of things. So those are the tenets of lifestyle medicine. And so what I actually do is I counsel patients typically in a pulmonary setting. So I'm seeing the patient because they have a lung problem. They might be short of breath. They might have an abnormal test like a CT scan or something like that. They may be coming to me because they have, for example, a history of cancer, like breast cancer or lung cancer, and now they have need follow-up imaging that shows a spot on their lung, so I need to work that up. But I always try to counsel my patients on at least the first 2 pillars of lifestyle medicine, which are a whole foods plant-based diet and exercise, because those 2 combined, diet is probably 80 to 90% of health, and the rest of them are like slightly smaller proportions. But if I can talk to patients about those 2 things primarily, then I find that I'm able to get people to start to reverse diseases. So sometimes it means, they're there to see me for lung issues, and they'll go home and they'll say, yeah, my lung doctor talked to me today about my diabetes in addition to my lung issues. But it's a good way to catch them, because as we both know, many physicians don't feel comfortable for a variety of reasons counseling patients on plant-based diets. And as you know, I gave a talk at Veg Fest last year at Atlanta Veg Fest. So if anyone is interested in knowing why their doctor doesn't talk to them or talk to other people about plant-based diets, I'd encourage them to watch that.
Yeah, excellent. So with the COVID-19 pandemic, have you been busy with that? Has that been part of your work now?
No, so I am doing mostly outpatient medicine right now. I had taken a break from ICU after years of being up all night, running into the ICU to crash people on ECMO and taking donor call, which I actually still do. So one of the things I still do, though I don't do lung transplant anymore, is I am what's called an intensivist. So I do ICU work, but I do consultative work with our local organ procurement organization. So when someone becomes brain dead in the ICU, so they've had a devastating stroke, they've been shot in the head, they've had a devastating car accident, and they die. So in other words, they have no brain activity whatsoever. Many times these people, their hearts are still beating because they're on life support, their lungs are still functioning because we are breathing for them. That is when people tend to be willing to take this tragedy and turn it into something positive, for example, donating organs. And so these donors are very unstable. It's like having a super unstable, critically ill patient. In this case, the person is clinically dead, though. And so we need to keep the donor stable and improve our ability to procure organs. So, for example, the lungs are very sensitive to changes that occur during brain death. And we know that up to 60% of lungs that we initially think don't look good and people will turn down are actually really great lungs to donate. Given the number of people that are dying on transplant lists, liver, heart, lung, that kind of thing, it's important to me to keep my foot in that world through making sure that we can help them procure better. And we've actually shown that since I and my colleagues got involved with our local OPO, we have dramatically improved the number of organs that get procured, which means the number of people whose lives are saved.
That's great. That is excellent work. That is really good.
And from an animal perspective, another reason it's important to me is we know that unfortunately humanity is such that we have a tendency to say, oh, well, if we can't find a solution, we're just going to use animals for that solution. And there's some pretty horrific things that go on in the transplant world. So, for example, growing organs in animals like sheep and things like that. So obviously the more organs that we're getting from humans, the better, because the less animals that are being used.
Wow, that is an interesting perspective. I would have never thought of that. So let me ask you this. As you know, we're in the middle of a pandemic, and because of a lot of protests that have been going on due to the terrible murder of George Floyd, and the people protesting in the street, protesting racial injustice, and just a long, way too long list of innocent people who've been killed. So they've taken to the streets and they're protesting, most of them peacefully, although there have been some incidents. But my question to you is, when you have these large gatherings of people, and we're still kind of, as far as I know, we're still in the pandemic, right? So
yeah.
My question is, what's going to happen? How are these large gatherings going to affect the spread of the virus?
So physicians and experts and epidemiologists are very concerned that we are going to see a bump in cases in the next few weeks to months. I see that many people are wearing masks, which is good. We need people to be wearing masks if they're going to be out. It's very difficult to physically distance, obviously, when you're in a peaceful protest or a protest where you're being tear gassed. When you are being tear gassed and shot with rubber bullets and that kind of thing, now you've got bodily fluids flying. We have found COVID in blood. So, you see blood spraying and that kind of thing. That's a dangerous exposure. If you aren't wearing goggles or a gas mask, your eyes are another source. Any mucosal membrane, so your nose, your mouth, but also your eyes. If you were to get blood or, someone gets tear gassed and they're coughing, because they can't breathe from the smoke and you're near them, yes, that's a decent exposure. On top of that, we have large groups of people that are protesting, and don't get me wrong, this isn't a criticism of the protests. I understand the need for the protests. Certainly when we talk about being out and about and physically distancing, this isn't people who just want haircuts or want to get their nails done, right? This is something that is a long time coming. So this is not in any way meant to say don't protest, but it is a concern for us that we are going to start seeing larger cases. On top of that, we don't really know what's going to happen as we start to see, where people are protesting police brutality and police are responding brutally to it. And so we are seeing people end up in hospitals and ERs with injuries and, being affected by the gas and the bullets and things like that. And, that's more cases of things that don't need to be in a hospital, but are now in a hospital because police are being very brutal, right? So
I didn't think of that either, but good point.
Well, that's another issue, is now we're taking up beds that, when I say taking up beds, obviously if someone is ill and has been injured, they need to be in the hospital, but this is something that never should have happened, right? That young boy in Austin was shot in the head by a rubber bullet and had to have brain surgery. That 75-year-old gentleman who I mean, I'm guessing because they haven't said what it is, but if I had to guess based on what happened and based on how he bled, I'm guessing he either had a subdural or an epidural hematoma and probably had to have brain surgery. Again, it's pure speculation. I have no idea, but simply based on my experience with seeing those kinds of injuries, that's what I would guess has had to happen with him. Something that never should have had to happen, and he's 75. And if he's in a hospital, he's at increased risk now because now he's around staff who are taking care of COVID patients. He's potentially around other COVID patients, that kind of thing.
Yeah. Can you talk about the racial disparities with COVID-19? How does that come into play?
So that is in and of itself a huge talk. In fact, if anyone is interested, I gave a talk to the Afro-Vegan Society. So if you go to their website, I think it's not quite up yet, but it's going to be up soon. It's a 2-part talk. So the first part is me going over what is COVID, how does it affect us, what are the treatment options, and there's some images of what it does to the lungs and that kind of thing. And then the second part is racial disparities. So the reason I bring that up is we could talk for 6 hours just on the racial disparities to explain COVID. But if I had to sum it up, there's a great slide that I have at the end, which is called the social determinants of healthcare, okay? Good health outcomes. And there are multiple different groups of categories in there. So there's everything from access to healthcare, having health insurance, there's economic stability, there's education and ability to have health literacy. But then there's also, do you have a secure home situation? Do you have a good work situation? And if you look at every one of those parameters at every level, Black, Indigenous, and people of color are disadvantaged systemically. So as an example, 80% of African Americans do not have the ability to work from home. Okay. If you look at low-income workers, the majority of low-income workers and the majority of frontline workers, if you consider those 2 separate groups, are people of color, whether they're Black, Indigenous, or another person of color. Okay. Now you combine those 2, which is what we're seeing now. So the cashiers, the people in environmental services, the transit workers, these are tending to be people of color. So they have no ability to physically distance, right? Then they come home, and what is home? Unfortunately, for most people, if you look at urban makeups versus suburban and rural tends to be very white. Urban tends to be Black, Indigenous, and people of color. And why is that? Because of systemic racism, the inability to purchase houses, that kind of thing. So we see that if you look at multi-unit housing, so apartments or low-income housing, either one of them, the majority of those people are going to be Black, Indigenous, or people of color. So now you're coming home and you don't have the ability to socially distance because you don't live in your own home. You probably can't tell from where I live, but I live in suburbia. I've got, 0.3 or 0.4 acres. In my backyard. I live in a neighborhood on the river, and I have a trail that's private to my neighborhood that nobody else is allowed to use that I could go running on. So I have the ability to remain healthy in a way that decreases my risk of disease, right? Let's talk a little bit for just a second about healthcare and access to healthcare. So when the ACA came out, the Affordable Care Act, which a lot of people call Obamacare, I mean, just ignoring the fact that the minute it came out, the GOP has been systematically stripping the benefits of the ACA from it so that then they can hold it up and go, see, it doesn't work, right? Now, I think most of us know that the ACA is a Band-Aid solution, but we were starting to see narrowing in the gap between healthcare coverage for Black, Indigenous, and people of color versus white people. However, when you compare, even though the gap narrowed, when you compare Black, Indigenous, and people of color to their white counterparts, they still consistently do worse in between 5 and 7 out of 10 categories that we traditionally look at for healthcare, things like access to healthcare. Not just access to healthcare, but can you afford to go? Like, it's one thing to have insurance, but can you afford your copays? Can you afford the bill for what happens if you end up in an ER or in a hospital? It's not enough to have insurance, right? You have to be able to afford everything else. You have to be able to afford medicines. Do you live in an area where you have a PCP? So let's say none of that is true and you can actually go to the doctor. We know that there is a significant amount of racial bias in medicine. It is very challenging for a Black person, particularly Black women, but Black men as well, to get the same degree of care. They've done studies, for example, that have shown that when they interview healthcare workers, physicians, nurses, nurse practitioners, other advanced practitioners, and they ask them about pain control, there is a bizarrely significant proportion of healthcare workers that truly believe that Black people do not feel pain in the same way that white people do. And we see this translated, right? I mean, I've certainly seen where I go to do a consultation and the nurse doesn't necessarily have to be a white nurse. It can be a nurse from a traditional minority group who will say something like, oh, this person is just histrionic, they're drug seeking, all this other stuff. And I go in to see the patient, and by every parameter that I can objectively judge this person, they're in real pain. And it's impacting their ability to get care. We know that if you look at maternal and fetal mortality, first of all, we have shockingly high maternal and fetal mortality across all races for a supposed advanced society, but it's particularly bad for Black, Indigenous, and people of color. So you add all of that together, it's very challenging in the midst of a pandemic to get good care. Now, the things that we haven't talked about are the fact that if you look at the biggest risk factors for the worst outcomes with COVID. So I want to backtrack for just a second. If you guys do take a look at my talk, you'll see that based on the data that we have, it is a complete myth that you cannot get sick and be in the hospital if you are young. In fact, the largest proportion of COVID hospitalized patients are between the ages of 20 and 60. Now, the largest portion of people who are dying are older. That is true. But if you look at the people who do worse, they're the people that have lung disease, they're the people that have heart disease, they're the people that have diseases like diabetes that compromise the immune system. So if you look at studies on healthcare disparities at every level, when you're talking about cholesterol control, blood sugar control, blood pressure control, Black people do worse than their white counterparts. They get hospitalized more for those diseases, right? All three of those are risk factors for heart disease. Let's talk about lung disease. We tend to see more asthma in teenage Black children than we do in their white counterparts. There are many reasons for that. One of them is something called pollution inequity. So if you look at across races, they've done studies. There's a great study from the Proceedings of the National Academy of Science, where they looked at how much pollution is each racial group responsible for, and then how much pollution are they exposed to. And pollution doesn't just cause things like asthma. The WHO estimates that millions of people die every year from heart disease, lung disease, and cancer related to pollution, right? But if you look at the people who have what's called pollution inequity, Black people and Hispanic people are exposed to more pollution than they're responsible for causing. White people are exposed on average to about 20% less pollution than they are responsible for causing.
Wow, that is an interesting fact. Wow.
Yes. So that slide is in my talk, and then you look at things like housing insecurity. So the pandemic has caused pretty significant economic instability for people that were already, on the border, right, of having housing and having job security and things like that. So now these folks, if you look at studies out of VCU, which is I think Virginia Commonwealth University, they found that if you're African American, you're 4 times more likely to get evicted, regardless of your socioeconomic status and income status. So if you're a white person with the same income, same socioeconomic status, you're 4 times less likely to get evicted. If you have housing insecurity in the middle of a pandemic, what does that do to your risk of getting COVID? Right? I mean, there are any number of reasons why there are racial disparities. I mean, I've just highlighted a few of them. There are far more, and like I said, even the talk that I gave, which went on for over an hour, I was really only sort of highlighting some basic facts. I mean, you could give a talk on each one of these sections that would last 2 hours each.
Yeah, well, thank you for touching on that. I just thought the listeners would like to hear that from an expert and just kind of get understanding of what's going on, because we hear the numbers and it's great to have some facts to understand the breakdown of why they're like that. Another question I have for you is, are there any advantages being vegan during the pandemic, the COVID-19 pandemic?
So we don't know. I mean, so one thing I want to be very clear about is, because I'm seeing this bizarre thing where people are going, I'm vegan, I can't get COVID, or, oh, I'm vegan, if I get COVID, it'll be mild. There's zero evidence that the virus is not going to infect you because you are vegan. Now, I want to make two distinguishing things. So veganism versus plant-based, right? So if you are eating a whole foods plant-based diet with minimal to low oil, yes, you are less likely, we assume you are less likely to have a bad outcome if you do get COVID, because you're less likely to have high blood pressure and heart disease and type 2 diabetes and those kinds of things. We do know that when you eat certain plant foods, it does boost your immune system. So for example, when you eat blueberries, small studies have shown that it can boost your natural killer cell activity, which is an important part of your immune system. We know that when you eat leafy green veggies, you induce something called nitric oxide synthase, which can only really happen when your endothelium, which is the lining of your blood vessels, is very calm and not inflamed. And we know that if you eat animal products of any kind, so not just meat, but also dairy and eggs, and some people, for whatever reason, don't consider fish and chicken meat. I've never understood that, but of course, all of those things inflame our blood vessels. So, for example, they did a study where they measured vasospasm. So that's when your blood vessel literally spasms. And within 30 seconds of animal fat and animal protein hitting the bloodstream, your blood vessels spasm. Okay, so they start to get really inflamed. Well, if they're inflamed, then they can't release something called nitric oxide synthase, I should say, which then results in nitric oxide. Why do we care about nitric oxide? Well, generally we care about nitric oxide because it causes the blood vessel to relax, meaning it helps with blood pressure. It also helps to heal it so that if there's no inflammation there, you have to have inflammation as the first insult to start getting blockages in your heart, okay? But from a COVID perspective, and this is all speculation, the challenge with anything when you talk about are vegans more or less protected, vegans are so few and far between, percentage-wise, that it's really hard to do a study looking at just vegans. In fact, if you look at most studies that say vegans are this or that, you have to take it with a grain of salt because they often lump vegetarians in. So whenever I see benefit in these studies, I'm always thinking, I'll bet you if you were just doing a study with the vegans, the benefit would be even larger than what the study is purporting. Yeah. But going back to what I was saying about nitric oxide, there is some evidence that COVID-19 does not do well when there's nitric oxide in the system. So one of the disease processes, there's sort of two phenotypes that we're seeing with COVID, and they overlap a little bit, so you can see both of them together. So one of them is something called ARDS, which is when the lungs start to get really inflamed and they fill with fluid, like the air sacs fill with fluid, so you can't really oxygenate well, you can't get rid of carbon dioxide, but then the lungs can stiffen up and scar down. The other problem that we're seeing that is somewhat unique to this process, and when I say somewhat unique, it's not that we don't see this when people get ill or when they get septic, which is like an overwhelming infection. We're just seeing it really commonly with COVID, and that's blood clotting, okay? And we're seeing blood clotting in a couple different ways. So we're seeing blood clotting like big clots in the veins in the leg that can then break off and travel up through the heart and then block off things in the lung. That's called a pulmonary embolus. But we're also seeing in the actual vessels that supply the lungs, that go to, the whole job of those vessels is to pick up oxygen and get rid of carbon dioxide as we breathe. Those small micro vessels are forming tiny, tiny clots right within the vessels. Typically, we don't see that. Typically, the clots that we see in the lung travel from other parts of the body and then block off areas of the lung. So we're trying things like blood thinners to see if that works, and clot busters, things that we use for ischemic stroke and for heart attacks, things like TPA. Sometimes it's working, sometimes it's not. So when I say sometimes, it's because we just don't have enough data yet from trials. There are ongoing trials to see what the right way is to manage this. But why am I bringing all of this up? Well, We know that when someone has ARDS because they struggle to oxygenate, we often give them inhaled nitric oxide to help them oxygenate. It doesn't improve their survival, but it allows them to oxygenate long enough to survive, right? But the other thing that some groups are doing, like in Boston, there's a couple universities that are doing some trials where they've noticed that COVID-19 does not survive and replicate well in a high nitric oxide environment. And so not only are they randomizing patients to inhale nitric oxide, they're randomizing healthcare workers to inhale nitric oxide to see if the ones that are randomized to it and are exposed to COVID-19 patients, do they do better? Are they more protected? So when it comes to things like that, I mean, can I say that if you eat a bunch of spinach, you're going to be protected from COVID-19? I cannot. Can I tell you that you are going to decrease your chance of having high blood pressure and heart disease and you're going to heal your blood vessels? Yes, there's plenty of evidence in the literature to show that, right? So that to me is the benefit of being plant-based. Now, the reason I say plant-based is you and I know veganism is an ethical stance, right? So when people say things like, well, I knew a vegan and he was anemic. Okay, well, an ethical stance can't make you anemic. A bad diet can make you anemic, right? So the reason I distinguish those two is, as a vegan, I'm super happy when I find out that people are vegan, right? That means we know that they're not harming animals, that we know that it's better for the environment. We know that it's also better for humans. Going back to racial disparities and pollution inequity, we're not just talking about coal industries and things like that, right? We know that brown and Black communities are dramatically affected by people who support the meat and dairy industry, because where are those industries preferentially placed? In poor Black and brown communities. And we see higher rates of respiratory illness and, water pollution and infections and cancers and things like that, all related to being near these industries. So, but my point is, going back to what I was saying, is if you are vegan, but you are vegan, the food part of your veganism involves a lot of processed foods and all the delicious cheeses and vegan meats and the vegan fried foods and things like that. Unfortunately, we know from studies like Adventist 2 that does not confer the kind of protection that we need from things like type 2 diabetes and heart disease and things like that, because you're eating the oils, you're eating the salt, so you can still inflame your vessels. Are you doing it to the degree of someone who eats a lot of animal products? Probably not. We know, for example, that if you do not eat any animal products at all, you can't produce something called TMAO, which is a highly inflammatory molecule that leads to heart disease and heart blockages and even some cancers. So there are certainly health benefits for that. I mean, obviously, veganism is not about our health, right? It's about the health of non-human persons. But I just wanted to make that distinction that being vegan in and of itself may not confer a ton of protection to us. It certainly confers protection to the animals, right? But being whole foods plant-based, or eating as close to a whole foods plant-based diet as you're willing, will dramatically help.
All right, well, thanks for that. I really appreciate that. And I thought that was a great comment that you said, where you see this thing going around where people think, oh, I'm vegan, I can't get COVID. Yeah, that's crazy. That's just one of the many myths that are going around. So let me ask you another question, and we'll kind of wrap it up here with this last question. So people are stuck at home, they're in quarantine. They're not working out as much as they used to. A lot of people are. At my office, the way that we have it is I work in the office so that a lot of other people can work at home. So people are working things out so that they're not together as often as they were. So my question is, for people who are living at home in quarantine, working from home, do you have any suggestions of things they can do to maintain their health, even though they're more stationary?
Yeah. So one of the things I want to mention right off the bat is, and you can find on my Instagram, you can actually find the post where I talk about the evidence for this, and I actually post a review article. So for anyone who's interested, my Instagram is @_theVegDoc. So one of the things that a lot of people don't really think about is alcohol intake. So certainly we're in stressful times, and it's very common sometimes for people to cope by, oh, I'm going to come home, I've had a bad day, I'm going to have a couple glasses of wine. The thing about that is, though, that we know, and this has nothing to do with COVID, this is just a fact with ARDS, this disease that COVID is causing at abnormally high rates compared to other diseases that can cause ARDS. We know that if you drink more than like a moderate amount, and a moderate amount for a woman is 1 glass of alcohol per day. For men, it's usually 2. If you're drinking more than a moderate or a high, if you're drinking like a high amount, and that includes the people who don't necessarily drink during the week, but they might have 2 6-packs on Saturday and 2 6-packs on Sunday, okay? You are 4 times more likely to develop ARDS. Whether you have COVID, whether you get into a car accident, whether you have the flu, anything like that. So as tempting as it is to do things like drink as a stress coping mechanism, I would encourage people not to do that, particularly right now, okay? Sleep is another big thing. The kids are at home, they're keeping college hours, right? So they're up till 2 in the morning, they're not waking up till 10 a.m., that kind of thing. It's really important that you get, if you're an adult, that you get traditional hours of sleep. Once we are adults, we sort of fall back to traditional circadian rhythms. Kids have totally different circadian rhythms, which is why they do better staying up till 2 in the morning and sleeping until 10. But adults don't. So getting 7 to 8 hours of good quality sleep is super important. If you or your partner snores, you wake up sleepy, you wake up not feeling refreshed, you wake up with morning headaches. If there's any chance you have something called sleep apnea, getting that diagnosed and treated is going to be critical for your long-term health, but also your short-term health. We know that sleep is restorative, and so if you're not sleeping well, it depresses your immune system, okay? So when you're at home, another thing that's really important is, a lot of people go to the gym, right? And we know that exercise is beneficial to boosting our immune system. I mean, literally, they've done studies where they watch you exercise, and if you're doing a moderate amount of exercise, your white blood cell count goes up after exercise. Now, if you do an extensive amount of exercise, like you run a marathon, you actually depress your immune system just a little bit for about a week, which is why a lot of times first-time marathoners will end up getting a little cold the week after they run a marathon. But it's really important to sustain that immune boosting with regular exercise. So what do you do if you can't go to a gym? Well, to some degree, it depends on your activity. So if you're somebody who runs on a treadmill, if you live in a neighborhood that is safe, try running outside. Now, it's getting very hot. I like to run outside, but I am a wuss when it comes to heat. So if anything above 70, I don't run outside. I am fortunate enough that I have a treadmill in my house. But if I didn't have a treadmill in my house, there are any number of free online programs you can do. Again, this is assuming you have good internet access, right? Many people don't have good internet access. But if you do have good internet access, there are any number of free websites where you can do kickboxing or low impact exercises, things like that. A minimum of 150 minutes a week is what is recommended for moderate exercise. If you do more than that, that's better. If you've never done exercise ever in your life, you have to talk to your doctor. If you have weight issues, if you have heart issues, you always need, well, really, honestly, anybody who doesn't exercise with or who has medical conditions, they need to talk to their doctor before embarking on exercise. But once you get the all clear from your personal doctor, start slow if you're not doing it now. So the other day, our power went out first because of some storms, and I was supposed to get on the treadmill to run. So instead of doing that, I literally walked up and down my stairs for 30 minutes, which was a mistake because then I couldn't move my legs the next day. But anything to get your heart rate up, that kind of thing. So another thing that's very tempting is when you're at home, you're literally right near the fridge, right? So it's super easy when you're bored to snack on things, right? So try to be more mindful about your eating. Try to pay attention to what you're eating. If you're someone like me who just really has not mastered the ability to keep a bag of chips in the house and eat 1 serving of chips, just don't bring them in the house, right? But really mindful, I mean, it's easy for me to say that. I don't have children in the house, right? So, if you have kids in the house or a spouse in the house who's eating a lot of junk food, it's more challenging for you, but really just try to be mindful of those things. I don't say any of these things. There's a lot of disturbing memes that I'm seeing on the internet about like quarantine weight gain, right? And I mean, this is not about fat shaming. Like, to me, it's not about the number on the scale. It's what are you putting in your mouth, right? We know from studies that if you are overweight, but you eat a healthy plant-based diet and you exercise, you are literally less likely to die than a skinny person who eats junk, i.e. animal foods, and doesn't exercise.
Yeah.
Right? So eating healthy to whatever degree you can. Another thing that I would recommend to people is try to practice some mindfulness. There's some really great free apps online that you can do for mindfulness, for meditation. It sounds kind of woo-woo and out there, but studies have actually shown that when you practice mindfulness or meditation, your focus increases, you're more efficient, but it also strengthens your immune system.
Well, yeah, and I would think yoga would kind of fall into that as well. I mean,
it does. Yoga is a little bit different. I mean, having trained with, my mother learned yoga as a child. So we learned yoga from my mother as a child, and I took classes in India. Yoga here is unfortunately very different. It's, in my opinion, not nearly as good because they just focus on the exercise portions of it. But there are practices with yoga where they do look at pranayama and, breathing exercises, and they are more mindful and they do the appropriate chanting. So like, you're not supposed to say namaste at the end of a yoga class. That's like a totally Western, bizarre BS thing, right? There's chants that you're supposed to do. So there are a lot of really awesome options out there, apps and things. I mean, I don't necessarily want to endorse any one over the other, just because, for everybody, things work differently for them. If you happen to be a healthcare worker, if you have something called an NPI number, there's an app called Headspace. You get free access to Headspace through the end of the year if you have an NPI number. For exercise videos, there's this guy out in Texas somewhere, used to be like a former MMA fighter. I like his exercise videos because he's also got like chair exercises for people who have limited mobility, or maybe someone who hasn't exercised very much in their life. And he's got low impact and high impact, and none of them are crazy. And it's called HASFIT, HASFIT.com. I do not get paid from this guy. They're just videos that I happen to follow.
Yeah, no, thank you for the advice. That's really good. And thank you for talking with me today and sharing your knowledge with the Atlanta Veg Fest and everybody who comes out to the fest and will be watching these things online. Is there any point that maybe we didn't discuss that you would like to make real quick? Anything on your mind that you think people should know?
Yeah. I mean, I think I just want to explain, because there's a lot of misunderstanding about what's going on with COVID. So things have changed a little bit, right? Like initially we were saying things like, don't wear a mask, nobody needs to wear a mask. The reason we were saying that is we were assuming that we'd lock down. The medical community thought we would lock down appropriately like they did in New Zealand, right? Which is basically eradicated it, like they did in Australia, right? So had we done that, we probably wouldn't be in the situation we're in now. The reason we're now saying wear masks is twofold. One, if everyone wears a mask, because wearing a surgical mask, not an N95, but wearing a surgical mask protects others from you. If everyone's wearing a mask, then everyone's protected, right? Assuming they're wearing it properly. Make sure when you wear your mask, it's covering your nose and your mouth. If it's only covering one, you might as well not be wearing it, okay? But the idea here is, and then you're hearing things like hydroxychloroquine's a great drug. Well, we never thought it was a great drug. The study was profoundly flawed, and we never understood why people were saying it was good in the medical community. Politicians were saying that, and we have since had multiple studies that show that not only does it not help, it harms.
Right.
So, so the reason that all of this is happening isn't because doctors don't know what they're doing or because there's some big conspiracy. This is the nature of science. It's just that normally this is not happening on CNN, right? Normally it's not being reported on daily on various news shows, right? Normally things happen at a slower pace. There's years of research. So here's a dumb example, but alcohol and ARDS. My research was in alcohol use in donors to see if it affected graft function in the recipient, the person who got the lungs, because there's something called primary graft dysfunction, which is essentially ARDS in a transplanted lung. So for many years, people laughed at us. They were like, that's crazy. There's no way that's true. No, it is true. But it took us multiple years of research to show that that was the case, because we weren't talking about pandemic type things, right? So during the pandemic, a lot of this is we're seeing this data getting churned out at a rate that we normally wouldn't necessarily see data. And it's not meant to be malicious, and it's not meant to be a conspiracy. It's people are just trying to help other people, right? So, you know, my colleagues and I talk all the time, hey, what do you do about this? Are you proning people, which is when you flip them to help them oxygenate? It's really dangerous. So I know some guys are like, we're absolutely not doing that because every time we prone them, they code. Right? So we're doing something slightly different. So it's not that medicine is the wild, wild west. It's not that things that we're just making stuff up as we go along. It's we base stuff initially on the data from China and Italy. Then we started to get our own data back, and we started making adjustments to that. And now we've got even more data. And so we make adjustments as we go.
Right. Right. Well, thank you very much for doing this, and we really appreciate it, Dr. Naik. Is there? You mentioned you had an Instagram account. If you want to mention that again.
Yeah, it's if you want to follow me, it's @_the-veg-doc. I do not talk about veganism per se on there, but if you're interested in learning more about the health benefits of a whole foods plant-based diet, and specifically what the literature shows, then I talk about the various studies and things like that. There is also some information on COVID up there as well. If you have some questions about what the studies are, I really try to break them down there as well. So if you want to follow me, that's a great place to get that information.
Excellent. Well, thank you very much. And, you know, we look forward to seeing you again at VegFest.
Thanks so much, Seth.
All right. Have a good one.